to one more YouTube and Instagram live. I hope everybody is ready with their questions, so we can start immediately. Or I have a case, I have a lot of cases to discuss. Previously, also they were sent on WhatsApp. If the doctors join in, so we can start. So very interesting case. I'll just share about cough. The doctor has sent me. I hope he's there. He's still not joined. So let him join. Then I can start I answer that cough symptom. So welcome Dr. Najot, Palak, Rajesh. In today's scenario, means what happens, there are a lot of cases of sunstroke, and lot of students and lot of practitioners, we basically tend to start everything with natriumur, everything with natriumur. So it is very important to now differentiate, because the effect of sunstrokes, it is not only natriumur. There are a lot of other medicines that have some symptom relation to sunstroke. Of course, there are a lot of medicines in the repertory, but whatever I have used in my practice, I'll just tell you some remedies that you should think about while using in sun. Welcome, Dr. Fatima. That is natriumur, of course, there. Think about natrium carb, antim crude, glonine, belladonna, amyl nitrate, and gelsemium. These are the mostly used medicines basically which I use in my day-to-day practice. Of course, natriumur, everybody knows that what is the remedies, what are the symptoms of natriumur and all. First interesting thing you should remember is in relation to antim crude also, we have cases of antim. Yeah, good afternoon, Dr. Tony, Bhumika Bhatt. Antim crude, a very interesting remedy. And whenever you are prescribing antim crude, sometimes what happens, you go from the sun to and you feel tired, depressed, you feel okay, forget it, nothing is happening, I can't do anything, and you become very sentimental, emotional, and there's loathing of life. Then you can have digestive complaints like from overeating and XYZ. But this I've seen in my practice. Anti-improved patient first goes mentally sick and then physical. And I've seen in lot many of cases in my practice. There are some cases will come to you like, doctor, sir, I have getting cramps in the stomach, the stools are with mucus, there's a lot of pain in the body, and I feel like I have to sleep down. In those cases, you have to think about natriumur. But when there is great sadness and weeping, you must think about antim crude. Very, very interesting. And the patient tells you, no, today I was had a severe headache, so much headache that I had to wound myself in the pillow and with what you call strong tourniquet, and I didn't want any light and all. Then you have to think about belladonna. And when the patient tells you that whenever there is sun, no, I feel absolutely depressed, I cannot work, and this has been happening since few years now. Sun, I have to avoid sun. There's no particular disease as such, there's no particular symptom, but the patient says that I have to avoid sun so that I feel better and happy. In this case, a very interesting remedy, that is chronic effects. Chronic effects of sun, you must think about natrium carb. And see, that's why natrium carb has a very, very interesting symptom, that natrium carb has what you call aversion to open air or dislikes to exercise, both mentally and physically. That is natrium carb. Welcome, Dr. Ruhi Rotte. Ruhi, yeah. Now, Jot, when sun heat makes migraine attacks, patient having vertigo on seeing moving train or any fast vehicle. See, whenever you are prescribing for migraine for some sun, it would relieve only some symptoms, because migraine from sun is a very, very normal symptom of migraine. Migraine from sun, migraine from smell, migraine from bad odors, migraine from taste, migraine from exercise, migraine from these all symptoms are very, very common symptoms of migraine. But yes, if it is a very, very pronounced and very, very important, the patient says, when the summer start, I just look into the sun and I start getting migraine. Then you can think about the remedies which I have told you: natriumur, natrium carb, black acid, antim crude, belladonna, glonine, gelsemium, lot of remedies. But in case of migraine, if you have watched my Instagram live, I have told a lot of things about migraine and what you have to see in case of migraine and how to enter the case of migraine. Most of the personalities in migraine, you will see a personality who gets excited, anxious, and anticipates very, very easily. Those are conditions where the migraine personalities I've seen have given good results. Of course, the modality, if it is very, very interesting, very, very syphilitic, then you can prescribe on these symptoms. Otherwise, natriumur is a very three-marking remedy for migraine. It would definitely have some symptom relief, but not cure. Gas soon as after eating, relief from vomiting and continued eructation. Yeah, see, this is again, the patient comes and tells you, डॉक्टर साहब, मैं जब भी खाता हूँ ना, मेरा पेट पूरा फूल जाता है. And this is again a very, very interesting. Of course, you have remedies like carbo, which would give you good results. But if you see in our day-to-day practice, if this patient goes to an allopathic doctor, he basically would prescribe some enzymes, enzomac tablet and all. It is lacking in enzymes. So it is important that the patient should have, it's called that yogurt type lactobacillus. That bacteria creates that enzyme, and that's what is important to first advise the patient to take lactobacillus. And if the patient is taking a lot of antibiotics, a lot of painkillers, or the patient is taking a lot of B12 tablets, also sometimes causes this type of complaints. So first take out the maintaining cause, as Hahnemann told us in our organ of medicine, and then you can start prescribing. The drugs are very, very simple. Carbovage is there, of course, China is there, lycopodium is there, Calicarb is there, Naxomin, Moscata is there, Naxomica is there, Natramur, Natramca, Phosphorus. But I'll tell you few cases in my practice. Of course, if I get time, I do have time. Hello, Dr. Babal, Dr. Vishaka. And moving train, Dr. Navjot, whatever I can see, it is cocculus indicus. The patient cannot stay still. I had an interesting case when the patient tells you that whenever I start eating, I have gas. So at the time of eating, a very interesting remedy that you should always think about is conium and sanicula. Then the patient says there is a lot of gas after eating. See, the patient always have that after eating or after drinking. So eating is, मैं जब भी खाना खाता हूँ, whenever I eat, I start getting that distension of the abdomen. In this case, carbohydrate, lycopodium, China is there, but do think about colchicum and borax. Very, very important remedy. These remedies are not used frequently in practice, but I have got very, very good results by using this practice. Of course, there are symptoms in these remedies that you have to think about and prescribe. Don't just prescribe because I have told. And when the patient, as Dr. asked Bhumika, when the patient says eructation, when I get eructations, I feel better. If this is the case, there are three remedies, very, very important. Please note down. And the first remedy is carbovage. The second remedy, natrum sulph. And third remedy is argentum nitricum. But some patient comes and tells you कि इतना gas, there is so much distension that even eructation does not ameliorate. Then you have to think about two remedies, doctor, very, very important. Please write down in your Medika. First is China, second is lycopodium. So these are things which should remember in a day-to-day practice, and of course try to differentiate. Then you can, in homeopathy, you have a lot of other conditions of distension, like distension because of grief, because of fruit, because of exertion, because of mental stress. So there are other remedies, but most of the time the patient comes to you after eating, and you have to know eructation is better or ameliorates. So these are the remedies which are very, very important in cases of stomach. Sir, hiatus hernia is also, yes. So hiatus hernia, basically, if it is not having any problem, it is a small hernia, small opening, nothing to worry about that, Dr. But think about these remedies. Dr. Pandya, welcome. Dr. Ushali, Dr. Hital, Homeopath Clinic, Dr. Varsha, I think. Good afternoon, Dr. Upal, Dr. Sajanwala. Disc at C4 and C5 level causing thecal compression and mild lateral and encroachment cervical spondylosis. A very, very interesting case, and you have to give result to the patient, because if there is a compression at the disc and cervical disc is problematic, because the patient starts writing or looking beyond the level of the neck, the pain increases, and that can cause formication and numbness in the arm. It's a very alarming condition. Make sure to first relieve the maintaining cause of the patient. This normally I've seen a lot of teachers, a lot of doctors, a lot of academicians who basically write, who work on the computer. Tell them basically, or give them that flap so that it does not come down. It is very important to treat the maintaining cause in these cases, because only painkillers or only prescribing medicine for pain will not give you result, because this is the case of compression, and it's an alarming condition, because when there is compression, then there has to be treated very, very, very fast. The first 3-4 remedies in case of cervical compression you must think about. First is semesifuga, rustox, macphos, phosphorus. These are very, very interesting remedies, and these remedies are so important that a single dose will relieve the complaints. In acute, I have told you guaiacum, Gaultheria, a very interesting remedy which is present in drugs of Hindustan, that is nigudium. Nigudium is also a very interesting remedy. Please do go home and read Nigudium from the Drugs of Hindustan. It's a fantastic remedy for cervical compression. So in these cases, this remedy would work. Dr. Ansar use on hydrocele. See, hydrocele again, if you have got cases of hydrocele, I have got interesting cases of hydrocele, especially in children's, and it works such fantastically in case of children. I have definitely got adults also cases, but I have so many cases where in children's few weeks back only I cured few cases of hydrocele of children. Few cases, not one, many cases. In hydrocele, one thing is very important to remember. First of all, make sure that you understand which side is the hydrocele. Left side, right side. Because in homeopathy, we have cases where the patient, just by knowing the side of hydrocele, you can be able to treat the condition. Simple condition, I'll tell you hydrocele of boys. Now, hydrocele of boys, 3 remedies I have used very, very successful in practice. First is rhododendron, second is pulsatilla, third is celosia, and fourth is abrotena. And the patient comes and tells you that there is a hydrocele and it is painful. So if there is painful, then there is inflammation. So don't prescribe rhododendron, celosia, abrotenum, pulsatilla. It will not work in case of inflammatory hydrocele. If there is inflammatory, painful, first remedy that everybody should think about is hemamelis. Second remedy, apis mellifica. Wonderful remedies and wonderful results. Sometimes patient comes to you that I had lifted weight. मैंने वेट उठाया और मेरा ऐसे सूज गया वहां पे. A very interesting remedy from hydrocele, from overlifting. Think about rustox. And when the patient comes and tells you inflammation is there, but it is not so acute, कभी कभी दुखता है but painful, then think about clematis, mercury, and thuja. I hope you understand, and do ask these type of questions and sites so that you will be able to prescribe. I had a wonderful case, the hydrocele was so big. It was looking so big, and I prescribed just by seeing that hydrocele a single dose of dietalis. And it worked very well. Then I shifted him to LM potency and the patient is cured. Of course, I don't cure all cases of hydrocele, but this you have to ask to the patient in order to get to the simillimum. Okay, I hope you get it. In adults, as I told you, hydrocele in adults, then you have to think about, okay, which side? Like a stone. Now, whenever the patient comes and tells you that the hydrocele is so is enlarged and it is feel like stone. So whenever the word stone comes, we have wonderful remedies. First think about calcarea floor. Very, very important. Especially if you get right-sided, think about silicea, think about ammonium carb, think about calcarea floor, think about causticum, and of course think about bryonia. Try to differentiate, and of course lycopodium because the right side, and try to differentiate the remedies. Your patient is between these 5 and 6 remedies. Okay, sir, what should be the vitiligo? Yeah, in my practice, as vitiligo is a one-sided disease, and then I used to get symptoms like vitiligo patient comes and tells you that it is right leg here and right leg here, right breast here and right breast here in the spine. And then I started prescribing on vitiligo symmetrical. But I got a lot of cases where vitiligo was so symmetrical in most of the cases, and that's why it can relieve in some complaints. It can had no change in some complaints. For me also, prescribing for vitiligo is not that I cure all cases of vitiligo, but yes, do I have cures? The first symptom in vitiligo is destruction. So Dr. Palak, do ask what are the destructive thoughts that has crossed the mind in the patient where he had faced a challenging situation. Remember this word, a destructive mental thought, whenever he had faced a challenging situation, and whether that thought was so severe that the patient implemented that thought and now he regrets. And that's the guilt feeling is there, or the reproach to self is there, or the patient says, I could have told so much, but I could not tell. The suppression is there, but that destructive thought, which is harming the body till now, and the patient is not able to get rid of the thought, that is the entry point of vitiligo. Of course, that is the entry point of vitiligo I see, and many of cases have given me very good results. Homeopath Shabbir, welcome. Bhavesh, welcome. It is Nigudium. Negedum, spinal compression. Yeah. Nicotine is a basic drug for pain, arthritis pain, but it works very well also. Yes, sir, I have given calcarea floor 6x. If you have, Dr. Navjot, calcarea floor LM potency to work better, normally when I start calcarea floor for stony hardness for hydrocele, I first start with LM potency 1 thrice a day, then I jump to 4, and then I jump to 7. And after 7, I use every alternate days. Yeah, Dr. Arora, very good afternoon. What are the indication of digital hydroxy? No, see, whatever I told you, Dr. Belwalkar, I just saw the size. I just saw the size of hydrocele, and of course, then the patient, see, whenever the size is too much, and the patient, see, automatically has a lot of anxiety, lot of stress, and develop lot of palpitation. Of course, those symptoms of delirium were definitely there. But let me be very frank, be very transparent. I entered the case because I found that the hydrocele is very large. In one of the mathematics, I don't know exactly where I have read, but it is written that the hydrocele is the size of what you call a bladder, and that's how I basically tried to prescribe digitalis, and it worked very well. I told you first in potency, then I shifted to LM potency, and that was it. Of course, because of that, then see, digitalis normally has those type of symptoms also, like I said before also, that palpitation, anxiety, and all. And one symptom I remember of that case, that the patient has very much, there was deadly weakness and a lot of sinking in the epigastric region. That's what led me to prescribe hydrocele. Symptoms of digitalis, and the pulse were irregular and very slow. That's how I prescribed hydrocele in that case. And a classical symptom of digitalis that everybody should remember, that digitalis has amelioration when the stomach is empty. Please write down in the Mater Medica, a digitalis amelioration is there when the stomach is empty, and I found useful this symptom in lot many of cases. Dr. Misha, Dr. Rupal, Dr. Divya, welcome. Can I give Silly 1 year boy to avoid thumb sucking? Dr. Arora, basically, thumb sucking is basically a very constitutional problem, and a lot of patients, first of all, let me tell you that when I was very young in my practice, we used to, doctors used to say apply something very bitter. So we used to apply kurchi, mother tincture, azadirachtin indica, mother tincture, on the where the patient sucks, but nothing used to work. And so I just stopped applying those things, and I started to constitutional treatment, which I got very much good results. In in case of the thumb sucking, I found very useful when the patient has been overloaded with a lot of emotions, got everything like on demand, without demand also, he becomes habituated to easy things in life, and that's why our sucking starts. That's what I have my observation of case of thumb sucking, but application I have not found it so useful, and I have never prescribed Celicia for that, so I'll not be able to answer it. Homeopathy for obsessive compulsive disorders, yes, Dr. Khan. Homeopathy is a fantastic remedy for obsessive compulsive disorders, and I have not one lot of cases where I have cured these complaints. Put me the word cured. Recently I had a case where I've been able to cure these type of complaints, and the only thing, in Sora, those complaints are very mild. In psychosis, that same complaint increases, and in syphilitic, that complaints becomes out of control. So go from Sora to psychosis to syphilis, that habit of the patient. For example, I always do the example, sometimes the patient is very fastidious. Then fastidious increases to rigidity, and rigidity increases to fanatism. So the same link is there. Fastidious, everything neat and clean. That lands up in fanatism, and that's obsessive compulsive neurosis. So anything which is out of control in case of mind, just try to trace that in Sora, and you'll be able to cure those complaints. L2, L3 disc bulge, acute pain remedies. Whenever if you get a case of disc bulge, and whatever I have seen, I have seen in cases of disc bulge like so severe that the patient is not able to walk also. And first thing which I tell the patient, is rest. It is very important that the patient takes rest on the back straight, and for the first week only uses the bathroom and something to eat. He just basically sits, otherwise he's lying on the bed. it is very, very important to tell to the patient. Otherwise, the results are not so encouraging. Only by medicine, the patient is doing his daily activity, sitting on laptop for hours and sitting here and there and walking, it will not work. In acute conditions, I have used lot of remedies. First, I use is Macphos. Second, I use is Colocynth. And third, you have to, then I use some rare remedies also like Stilingina, if you have heard that name. Stilingina, very, very interesting remedy. And Stilingina is Queen's root. And I use Aristolochia, Arenia diadana. These are the rare remedies which I use in my practice in repetition. If I'm using that potency in 1 potency also, repetition 2 hourly, 3 hourly, and when the complaints are better, automatically I subside. I taper it off. But I have seen in few cases where the patient comes with lot of pain, and the patient will also do anything, treat the pain, and he starts abusing and do whatever you can. He starts speaking bad words. In this case, I have seen fantastically, automatically the constitutional symptom starts coming when the body is forced to in a situation of challenge. In those conditions, Nux moscata, Veratrum viridi, chamomilla works wonderfully, which has no symptoms, sometimes relation to pain, but because of the constitutional effect, it works wonderfully. So do try these remedies in also in your practice, and if you get results, do share on the YouTube so that we all can learn. Welcome, Dr. Palika, Dr. Chawla. Lymphoblastic leukemia and role of homeopathy. Acute lymphoblastic leukemia, I had few patients also. They on treatment, still not cured, but they are very happy with the treatment. The acute episodes have tapered off. In those cases, I basically ask the family history, very, very important, and what led to that leukemia, destructive thoughts. For example, I had a child suffering from those problems, and in the school, he was bullied too much. He was brilliant, he was good, but had fear of standing and giving answers. Though he knew everything, he could not perform, and he felt that I am such a brilliant person, but because I cannot speak, I'm a failure in life. He went in so depressive curls and landed up in that disease, and that's so the entry point in my case. And we prescribed the remedy, and the patient came out. Uh, yeah, Dr. Tony, welcome. Vishaka, yeah, thank you. Sapunare and cough. I'll get back to Palak. I have few questions on what I think on YouTube. I'll just finish that. Violent, loud, dry cough day and night. I guess lying cannot sleep. Must sit up. I used Rumex, Sanguinura can, Causticum, Pulsatilla, Brownia, Naxomica, Corallium. No result. At last, Hyosamus with improvement. See, you have used lot of remedies, Dr. Me, and if you find the result is there in Hyosamus, I think wait, increase the potency or shift to LM potency. So kindly repeat those medicines for lumbar pain. Yeah, so I have acute. You can use Macphos, you can use Colocynth, you can use Arenia diadana, you can use Nephilim, you can use Nigudium. But I have told sometimes the patient had the constitutional symptoms also, like shouting, terrible, using bad words. And sometimes the opposite is that the patient is very shy, very timid, just sleep down, doesn't want to disturb anybody. So shouting part, think about chamomilla, think about Nux moscata, think about these remedies, and the silent part, then you can think about remedies where the patient does not want to tell and doesn't want to disturb the parents, stephysagria, and all those remedies. In fact, I have a very interesting case now of a tumor in the spine in a child of 6 years of age, and the doctor has advised him surgery because he feels that the tumor enlarges and it's area of bladder and defecation area. If that enlarges, then the problem will be in defecation and all. The child used to play the whole day, but when he used to go and sleep in the night, the pain starts, and he could not sleep in the night. And he did not tell the parents because parents would get stressed out. That child, I have prescribed the remedy, is much better with the remedy. For the first time in 4 days, he has not taken any painkillers to sleep. It's just 1 week before, but I prescribe that remedy. So if he is better, I'll definitely share my thoughts with you on that remedy. But a risky case, once the surgeon has told you that you have to operate the case, and suddenly you tell wait, and something wrong happens, then you are responsible. So whenever you are treating those type of cases, make sure that your prescription has to be right. That there is no other thing, because otherwise you land up in problem and you'll be spoiling the health of the patient. So make sure that your prescriptions are good. Next, Babel, just a minute, Palak, okay? Reduction of pressure from closed ear by holding the nose and pressing from the inside. Which rubric? Pressure emulates. It is also pressure from inside. If it doesn't cure, Dr. Pal, it will cure. Why you have used? Be very positive. If you feel that the patient is improving, so why do you feel it will not improve? It will improve. So don't worry about that. And if it does not improve, do send me some modalities more than this, because this case is not. I told you a case of arsulflavum, no? One of the child of 5 6 years I prescribed, I think Bephitis, Rumex did not work. Then I asked the history, and he had history of skin separation, and I prescribed the patient arsulflavum flavum 200, and that cured the case. If you remember that case. So if you don't get, then some symptoms have to be there in the case. Okay, Dr. Manjot, remember that case. Yeah, Dr. Babal, I have don't know exactly what symptom to take, but in this case, basically, I would not prescribe anything, because it's basically physiological demand and physiological symptom. Just tell the patient to have something for chewing, and that will get cured. So that's it. So coming to saponera, whatever Dr. Palak has asked about cough. Now, see, there are some cases where you prescribe for cough, but there are some things you have to remember apart from cough symptoms also. And in saponera, one thing is very important that I've seen. There is lot of pain in the eyes. There is lot of pain in the eyes, and because of that, intraocular pressure has increased because of coughing and coughing. So this is a very, very important symptom of saponera. And one symptom I have given in my YouTube, whenever I have taken symptoms of cough. But of late, when I'm prescribing saponera, I've got these symptoms, that violent pain in the eyes because of glaucoma, and the ciliary neuralgia because of coughing. Of course, the cough is very violent, it is very acute, followed by dyspnea. So make sure that you again see that type of cough in my YouTube channel. I have described cough, and you'll be able to do that. Okay. Boric, gives a very, very interesting symptom of saponera, that will often break up a cold. Will often break up a cold. Like will often break up that pus discharge, and you prescribe Hiparsil. So in saponera, Boric has beautifully written, will break open the cold. That's important. Umesh Babal. Yeah, Dr. Babal. So I exactly don't know what is that. I gave Pulsatlan, years are free now, but from time to time she had to do this pressure and here. Yeah, this is if you see that sometimes give the patient Phytum, and ask the patient to take it in the morning, this type after food, and make the patient disciplined to eat the Phytum also. When he is disciplined to eat the Phytum, no, automatically what happens, he says, whenever I'm taking that dose in the afternoon, you told after lunch, after dinner, or after lunch 1 hour, that works better. And then you can understand it's basically related to mind, and there's no need for the medicine. Sometimes we give a remedy where it is not necessary to give a remedy. And for example, X remedy is given, you say, you write in your mathematics, this X remedy is working for this complaints. So sometimes you're misguided by your own self. So these cases, basically, if you prescribe Phytum also, no, and then just wait and see how is the difference. Next time, give him Phytum and disciplined Phytum, and you will see the patient will respond to that treatment. Mithilal Jain, welcome. So, oh God, so it's already 3:30, half an hour gone very fast. I hope you're understanding. Sometimes what happens is that I'm a bit fast, and people keep saying that we don't get the remedies and we don't understand those remedies, and also I'm a bit fast. But if you can rewatch that WhatsApp, YouTube or Instagram, we'll be able to understand. Okay. Choking with acidity. So whenever, see, if you have complaints, and this is very, very common in our day to day practice, patient बोलता है कि भाई मुझे गले में घुटन समान लगता है acidity की वजह से. Make sure that the घुटन is basically either GERD, GERD, or it is because of something else. It's because when the reflux acid comes, that's how you basically get choking. But just telling you the remedies on choking, write few remedies which are very, very used in my practice. First, use hyoscyamus. Second, use sulfur. Third, use causticum. Fourth, use spongia. And fifth, use lacam. This has given me very good results. But only acidity choking, sometimes it becomes a very, very common problem. Ask some symptoms more at what time. That's important also. Okay, gynecomastia. Gynecomastia, basically, somebody had told me also, I have used very interestingly remedy Phytoleuca. And I have used Phytoleuca mother tincture, local application also, and phytoleucine potency also, and that has given me fairly good results. Of course, whole of the gynecomastia was not cured, but the patient said that now if I go in public and wear a banyan or inner, it does not look too odd, and the people don't laugh at me. So at that time, I have been able to do this in my practice. So I've used conium, I've used phytoleuca, local applications also, and of late, I have found a lot of cases in young persons who have matured very fast, precocious, and the breast has become very tight, and so in those cases, I have used calcarea LM potency starting from 0/7. That has given me good results. And sometimes what you get early puberty, like in female, in male also. In those conditions, I have used very interesting the remedy progesterone and estrogen in potencies. That has also given me very good results. Okay, I told you a case of girl, who was menstruating very early and had hirsutism of face and very loud voice, like male type of voice, and had prescribed that case a single dose of testosterone, and whole menses cycle, which was not coming normal, came to normal because it was the androgen effect in a female. So in either or case, you can use in gents also for gynecomastia, progesterone, estrogen, and for ladies of irregular menstruation, you can use testosterone. That works very well. I hope you understood, Dr. Bhumika. Just give me the feedback so that I know that I have answered properly and you're understanding. So I can always uh, share better opinion. Dr. Wag, good afternoon. So, Dr. Paul, you will get the number. I think a lot of people have my number now. Phytum, Dr. Barbal, is placebo. Placebo. And I tell that disciplined placebo, disciplined phytum. So you understand it is not the pulsatility that's work. It is the faith in the patient, in the doctor, that is worked. If the patient has a lot of faith in the doctor, no, automatically everything starts working. These type of complaints, which are most of the times, of course, it could be there, but most of the time it is sometimes psychological also. So confirm your prescriptions. First, give placebo, yeah, that is blank pills, disciplined blank pills, and then you can shift to a remedy if it does not work. So everybody, thank you. Half an hour passes very quickly, and I hope you understood. And do keep writing. Who don't have my WhatsApp number, I'll share it with you. And do write the feedbacks, so that I also improve on teaching. It's been, I think, how many years? I started in COVID, and it's been fantastic journey answering your questions and knowing my strength of mathematics also. Sometimes also I cannot get every remedy very fast, but it has really made me a very good and a quick learner. So thank you so much. Thank you for joining. Until next time, I'll just answer one. Sir, after exam, my mom, she's having backache and flank pains. Wait for some time, Dr. Anuj. She'll improve. Okay, just wait. Testosterone in potency. Yeah, in potency. Little eruption. Yeah, that's what I'm telling you. Just wait for some time. She'll be all right. And Dr. Vaishnav, for testosterone in potency. Yes. So thank you everybody for your patience sharing. And until next time, next Saturday. Bye bye.